Chronic obstructive pulmonary disease, COPD, and asthma are two distinct respiratory conditions that can significantly impact breathing, but they vary in causes, progression, and management. COPD is characterized by increasing breathlessness, frequent coughing, wheezing, and tightness in the chest, whereas asthma symptoms often include intermittent wheezing, chest tightness, shortness of breath, and coughing that may worsen at night or early morning. Treatment for COPD typically focuses on relieving symptoms and slowing progression through medications like bronchodilators and corticosteroids, lifestyle changes, and pulmonary rehabilitation, while asthma management revolves around avoiding triggers, using inhaled corticosteroids, and rescue inhalers for acute relief. Smoking is a major risk factor for COPD, along with exposure to certain gases and fumes, while asthma is often associated with genetic factors, allergies, and environmental triggers. Understanding the distinctions between COPD and asthma is crucial in ensuring proper treatment and improving quality of life for those affected. Here's a detailed look at the nuanced aspects of COPD versus asthma treatment. Affected lung structure, alveoli versus bronchi. In contrasting COPD and asthma treatments concerning the affected lung structures, it's crucial to recognize that COPD primarily damages the alveoli, while in asthma, inflammation targets the bronchi. Treatment in COPD, where the alveoli are compromised due to emphysema or chronic bronchitis, often includes bronchodilators, inhaled steroids, and pulmonary rehabilitation to manage symptoms and improve quality of life. Oxygen therapy may also be necessary. In contrast, asthma treatment focuses on reducing bronchial inflammation and preventing bronchospasm through the use of inhaled corticosteroids, leukotriene modifiers, and long-acting beta agonists. Fast-acting rescue inhalers are also essential for immediate symptom relief during an asthma attack. Addressing the distinct pathologies in the lung structures dictates a tailored therapeutic approach for each condition. Nature of illness, often bacterial versus frequently viral. In the treatment of COPD, chronic obstructive pulmonary disease, versus asthma, the approach largely hinges upon the nature of the underlying triggers and pathophysiology. COPD is often exacerbated by bacterial infections, necessitating the use of antibiotics alongside bronchodilators and steroids to manage flare-ups. In contrast, asthma is commonly provoked by viral infections or allergens, and while antibiotics are typically not beneficial against viruses, asthma management focuses on long-term control with inhaled corticosteroids and bronchodilators to prevent and relieve symptoms. The distinction is crucial as it influences the choice of medication, with the goal of reducing inflammation and preventing airway obstruction specific to the disease's origin. Duration of symptoms: weeks to months versus days to weeks. Chronic obstructive pulmonary disease, COPD, and asthma are both chronic inflammatory disorders of the airways, but their treatments diverge significantly due to differences in their pathophysiology and symptom duration. While asthma can be characterized by episodes of airway obstruction that vary in severity, often improving in days to weeks, COPD presents with persistent symptoms lasting weeks to months, reflecting irreversible airway changes. Asthma treatment focuses on rapid relief medications like short-acting bronchodilators and anti-inflammatory corticosteroids to control acute episodes. Conversely, COPD management emphasizes long-acting bronchodilators and inhaled steroids to maintain airflow and minimize exacerbations, along with pulmonary rehabilitation and lifestyle adjustments to slow disease progression. Recognizing these distinctions is crucial for tailoring appropriate patient-centric treatment strategies. Presence of fever, common in pneumonia versus less common in bronchitis. Chronic obstructive pulmonary disease, COPD, and asthma are both respiratory conditions with overlapping symptoms like wheezing, coughing, and shortness of breath, but their treatments differ. COPD, generally caused by long-term exposure to irritants that damage the lungs and airways, is commonly managed with bronchodilators, corticosteroids, and lifestyle changes, including smoking cessation. Oxygen therapy and pulmonary rehabilitation may also be prescribed. Asthma, often triggered by allergens or exercise, is primarily treated with inhaled corticosteroids to reduce inflammation and rescue inhalers for acute symptoms. Moreover, the presence of fever can help differentiate between other respiratory ailments. It's uncommon in bronchitis, but more common in pneumonia, guiding physicians towards the right diagnosis and treatment approach, be it antibiotics for bacterial pneumonia or supportive care for viral infections, in contrast to the chronic management of COPD and asthma. Breath sounds, crackles versus wheezing. In the realm of respiratory ailments, COPD, chronic obstructive pulmonary disease, and asthma represent two distinct entities often intertwined in clinical presentation, yet each demands a tailored therapeutic approach. Breath sounds offer valuable clues. Crackles typically manifest in COPD, indicating the presence of mucus in the airways as a result of chronic bronchitis. Wheezing, however, is more characteristic of asthma, signifying bronchoconstriction and airway inflammation. Treatment for COPD may involve bronchodilators, corticosteroids, and lifestyle changes like smoking cessation, while asthma management focuses on long-term control with inhaled steroids and quick-relief rescue inhalers to address acute episodes. Timely differentiation is crucial to prevent exacerbations and optimize respiratory function, highlighting the importance of nuanced clinical evaluation and individualized care strategies.